Welcome to this Clinical Explainer. Today, we're going to completely rethink how we view blood types. We're going to take blood type genetics and transform it from, just a trauma bay afterthought, like a letter on a driver's license or a quick check before a transfusion, into a highly structured, preventative tool for your primary care practice. We are moving way beyond basic compatibility here, and we're going to look at the specific biological vulnerabilities that are literally inherent in your patient's red blood cells.
Now, take a look at this quote. A major study published in the Neurology Journal found that your blood type is a direct predictor of cognitive decline and stroke risk. Let that sink in for a second. Other data from the American Heart Association backs this up entirely, proving that non-O types face a significantly higher risk of heart failure. So this explainer is specifically designed to give you the exact safety loops you need to diffuse these hidden biological time bombs within your own patient panels.
So, here's our roadmap for today. First, the antigen biological mechanism. Second, type O, focusing on GI and hemorrhage risks. Third, type A, coagulation in oncology. Fourth, the unique risk profiles for types B and AB. And finally, number 5, Rh-negative clinical considerations. All right, let's jump right into section 1, the antigen biological mechanism. It really all comes down to antigens. Think of an antigen as basically biological Velcro right on the surface of your red blood cells. Type A blood has A-style Velcro, type B has B-style Velcro, and type O is completely naked. It has 0 antigens. Now, this Velcro does 2 huge things. It dictates how thick or thin the blood is, and it acts as a highly specific docking station for bacteria and viruses. I highly recommend using this friendly tennis ball and Velcro analogy right there in the exam room. It really helps patients quickly understand why their specific blood type attracts certain pathogens or causes specific vascular issues. Moving right along to section 2, type O, GI and hemorrhage. So nearly 40% of the world carries type O blood. That means you're seeing these specific biological vulnerabilities in your exam rooms literally every single day without even realizing it. We always tend to think of type O as just the strong, universal donor, right? But they actually have a very distinct, very serious set of risks. Because type O blood lacks those sticky A or B antigens, these patients naturally have much lower levels of a clotting protein called the von Willebrand factor. This means their blood is chemically slippery. They've got this superflow blood that makes them practically bulletproof against deep vein thrombosis and random clots. But there is a terrifying trade-off here. They bleed out faster than anyone else in trauma or surgery. Furthermore, their cells express the H antigen, which acts as a literal landing strip for severe GI bugs. Cholera, norovirus, and Helicobacter pylori have actually evolved to lock perfectly onto this H antigen. So the crucial takeaway is that while they're protected from random clots, their biological profile practically invites severe dehydration from GI bugs and rapid, difficult-to-control bleeding during medical procedures. Okay, so what do we actually do with this? Here is your actionable reference guide for your type O patients. First, because their gut lining is a massive target for bacteria, their stomach acid is their primary shield. You've got to advise them to avoid chronic antacid use unless absolutely necessary. Second, proactively screen for H. pylori the absolute second they report gastric burning, because they are genetically prone to ulcers. And finally, if they are scheduling any procedure, even dental work, explicitly flag their chart for the surgical team to prepare extra clotting agents. Next up, section 3, type A, coagulation and oncology. What's absolutely fascinating here is the diametric opposition between the two. If type O is pumping water, your sedentary type A patients are essentially pumping thick maple syrup. Type A blood is totally loaded with the A antigen, making it highly susceptible to hypercoagulability. Simply put, it absolutely loves to clot. When that sticky blood sits still, it clumps. This is exactly why your type A patients who sit at a desk for 8 hours a day face a statistically higher risk of deep vein thrombosis, pulmonary embolisms, and heart attacks. On top of that, their biology naturally produces higher levels of the stress hormone cortisol, which literally thickens their blood even further. Because the A antigen alters how cells stick together and signals this exaggerated inflammation response, especially when they interact with bacteria like H. pylori, epidemiological studies have found a chilling link to gastric and pancreatic cancers. These patients require aggressive, proactive monitoring. So how do we manage this? In your clinic, you need to frame these interventions not just as gentle lifestyle suggestions, but as vital medical prescriptions required to keep their sticky, syrup-like blood moving safely. Prescribe an anti-inflammatory, plant-based diet rich in natural blood thinners. We're talking ginger, garlic, turmeric. Write them a literal movement RX. Tell them they should never sit for more than 45 minutes at a time. Look them in the eye and tell them movement is stroke prevention. And mandate stress management techniques like breathing exercises to actively lower that blood-thickening cortisol. All right, let's shift gears to Section 4, Types B and AB risk profiles. Type B positive blood is relatively rare, found in just about 10% of the population. Now, these patients very often show elevated C-reactive protein, or CRP, markers. They are highly prone to vascular inflammation. Think of their arteries like a garden hose. Type B blood can make the inside of that hose rough and inflamed, which leads directly to peripheral artery disease. Furthermore, the B antigen is a favorite anchor for Salmonella and E. coli. So, for your type B patients who come in complaining of cold hands, immediately assess their endothelial function. That's an early warning sign of circulation issues. And advise extreme vigilance with poultry and egg hygiene to avoid severe, long-lasting food poisoning. And then we have type AB positive, found in less than 4% of the population. Shockingly, type AB patients are 82% more likely to develop cognitive issues and memory loss compared to other blood types. 82%! Why? Well, because they possess both antigens, they're prone to elevated factor VIII clotting proteins, which creates this awful sludge effect in the tiny microvessels of the brain. Over decades, that poor microcirculation slowly starves their brain cells of oxygen. So, here are your targeted lifestyle prescriptions for these groups. For your type B folks, prescribe nitric oxide-rich foods like beets and leafy greens to naturally dilate those inflamed blood vessels. For your type AB patients, strict blood pressure management is paramount because high pressure accelerates that cognitive decline. You've got to make it clear to them that cardiovascular exercise isn't just about weight loss. It is essential oxygen delivery to the brain's capillaries to stave off age-related decline. Daily brain games? Tell them those are simply not optional. That brings us to Section 5, Rh-negative clinical considerations. Only about 15% of the global population carries an Rh-negative blood type. Think about it this way. If positive blood is a house with a welcome mat, negative blood is a house with a strict keep-out sign. This missing protein creates a terrifying scarcity trap during emergency trauma events because these patients can only safely receive blood from other negative donors. Now, the most immediate critical issue here arises in obstetrics. If an Rh-negative woman carries an Rh-positive baby, her immune system's white blood cells can actually cross the placenta and attack the fetus as a foreign invader. You can never skip this crucial biological translation with your expectant mothers. You must explain that the RhoGAM shot is the ultimate safety loop. It effectively cloaks the baby's blood cells, blinding the mother's immune system to the mismatch and preventing a fatal outcome. When it comes to surgical prep for an Rh-negative patient, your protocols have got to be completely ironclad. Because an AB-negative patient, for example, is basically a biological ghost, found in less than 0.6% of humans. You just cannot rely on the precarious public blood supply. You must initiate a strict autologous donation protocol weeks before any scheduled surgery, having the hospital bank their own blood. Also, strongly advise all your negative patients to wear a medical ID bracelet. It will absolutely save doctors critical time during an emergency. Finally, let's move to our clinical takeaways. Your patients are highly specific biological machines, but the medical system honestly too often treats them like generalized statistics. So, now that you hold the biological manual for these genetic targets, you know exactly who is prone to hemorrhage, who is pumping sticky blood, who faces cognitive sludge, and who is incredibly vulnerable to severe bacterial infections. The real question is, how will you proactively use this to save your next patient's life? I strongly challenge you to consider integrating blood type reviews into every single annual physical to deliver truly personalized, preventative medicine. Thanks so much for joining me for this explainer, and I'll catch you next time.